You say prenatal care, you're saying that everything that happens between the time of conception to the time of delivery, and that's what we call antenatal or prenatal. Natal means delivery, before you go and labor, before you go into labor and deliver. And therefore, what one should actually, try to make sure you do is, before you get pregnant, we must make sure that the woman is healthy enough, strong enough to carry the pregnancy. And therefore, there's what we call pre-pregnancy counseling. You should have a pre-pregnancy counseling. In this part of the world, many people don't even see the doctor, or the doctors don't see you until you are pregnant. But in more advanced societies, the doctor will have seen you, the doctor will have counseled you. You will have seen the doctor one time or the other. That is why when people die, they see their dental record, this record. Here, you don't do that. Therefore, it is advisable that before you even get pregnant, you see a specialist who will counsel you. And in this counseling, you're talking about what are the problems that you have medically, and what do you expect when you're pregnant, what are the problems in the family that can affect this pregnancy. And then when the baby comes, when the pregnancy comes, it is advisable that you go to the specialist, those who are trained to, to take care of antenatal, early enough for you to have a baseline as to what is going to happen in this pregnancy and be able to predict, as it were. Pregnancy is not a disease, but it can be complicated by some medical conditions that could be dangerous either to the baby or to the mother. That's why it is necessary. It is necessary that you not only, see doctor, you must see the right people so that you have the right counseling. Now, specifically talking about blighted ovum, it's one of the things that can occur when there is pregnancy. From the start, I want us to know when the egg meets the sperm, there is fertilization. And this one takes place in the tube. Incidentally, this is the womb. The egg will meet the sperm in the tube, in this tube. The sperm is deposited in the vagina, and then it moves to the tube. The egg is from the ovary, comes to the tube, and they meet. When they meet there is fertilization. The conceptus, that is the baby in the making, will now come back to the womb and start to grow. That's what we call implantation. Now, when the baby implants in the womb, the earliest sign, especially ultrasound, when you use ultrasound, is a small halo. We call it a gestational sac. And you expect that this will appear within maybe 4.5, 5 weeks, maximum 6 weeks. If you do a very good ultrasound, you will see that sac. By the time you get into 7 weeks, 6, 7 weeks, 8 weeks, a baby should come into that sac, what we call a fetal pool will come into that sac. If that fetal pool does not appear, that is what we call a blighted ovum. The baby is supposed to will be growing in the womb. If there's a sac inside that place, but there is no fetal pool, then you say there is a blighted ovum. The thing that appears first is a gestational sac, as I said. That's by ultrasound. But when you get into 6, 7 weeks, you expect to see another baby, a baby growing into that inside the sac. If that does not appear, then that's a blighted ovum. By the time you are getting to 8 weeks and doesn't show, it means that that pregnancy is abnormal. Now, that is one cause of abortion, what we call miscarriage. And I want to know that it's fairly common. In fact, miscarriage or abortion occurs in up to about 30 to 40% of pregnancies. And the ones that occur early, most of them are due to abnormalities in the baby. And fetal pool can be one of the results. What we get. Blighted ovum can be one of the things that you see.
You continue. You continue. I'll leave it now. Okay. So the second issue that we'd like to talk about is
ectopic pregnancy. Okay? Normally, as I explained for blighted ovum, pregnancy grows in the womb. Fertilization takes place in the tube, but baby comes to the womb to grow. Any baby that is growing outside the womb is ectopic. That is in the abnormal place. In fact, the womb is even divided into the body of the womb and the cervix. Into the body and the cervix. You have the body of the womb and you have the cervix down there. So, any baby that wants to grow should be inside the body. If it's growing in the cervix, it's abnormal. If it's growing in the tube, it is abnormal. It is growing on the ovary, it is abnormal. Sometimes it may not even grow in that place. It could be outside and be growing on the intestine. Those are all ectopic pregnancies. Therefore, the normal place for the growth and development of the baby is inside the womb. Any other one is ectopic. And it is a very dangerous thing.
What can be done?
Oh, it causes a lot of death, causes a lot of morbidity and problems for the woman. That's why you must have a very high index of suspicion. Now, how do we get ectopic? How does it come? Most of the time it's because of abnormalities in the tuber problems. Maybe because of infection or any other thing. What I'm saying is, if there is tuber problem, infection, which is the commonest cause, it means that the movement of the baby, fertilized egg from the tube to the womb is disturbed, and it can continue to grow there. Therefore, you can have ectopic. It could be, if it's about to be aborted and staying in the cervix, you can have ectopia in the cervix. If it grows outside the womb on the ovary, sometimes the sperm can come out and fertilize in the ovary, and we have ovarian pregnancy. Therefore, that one is ectopic also. The commonest signs of ectopic pregnancy is pain, abdominal pain. The woman is pregnant, or even when you suspect pregnancy, sometimes you have not even missed your menses and there's severe pain. Then the doctor must check. Pain, abnormal bleeding. You're bleeding through the vagina or bleeding, inside. Sometimes people will just faint. You can faint in your office if you are bleeding inside. That's happened several times. Faint at home. Or if it ruptures, the patient, because of severe pain, you just faint, you collapse. If those things happen, then ectopic, and then you can do ultrasound too. What can be done? In this environment, the commonest way of treating a patient with ectopic is to do surgery. You open the abdomen, remove the sac, remove the fetus that is growing, and make sure you arrest bleeding. You stop the point of bleeding. But medicine has developed more than that. Nowadays, you can actually dictate ectopic before it ruptures. Therefore, you can do ultrasound. That's why I say people should come to hospital early enough. If you just miss yourself menses and you come and they do ultrasound, the pregnancy test is positive and there is no baby in the womb, then the doctor will ask, where is the baby? Where is the baby? And sometimes you can see the baby in the tube. Sometimes you can see the ovary. You can see it wherever it is at time. And you can arrest that one. So nowadays, people even inject chemical to kill that baby at that point. Or they do what we call, pinhole surgery to remove that place instead of doing major operation when you have to open the woman up. Preeclampsia is a condition, usually we used to say it's a triad of hypertension, proteinuria, protein in the urine. The woman is shedding protein in the urine, and the legs are swollen, edema. But nowadays, the major factor should be hypertension, high blood pressure, and protein in the urine. You know, if you have, that's what we call preeclampsia. Hypertension and protein in the urine. Hypertension because the blood pressure is high. Protein in the urine because that pressure is high enough to affect the kidneys. It affects the functions of the kidney. And the danger is that the blood pressure can be so high as to cause the woman to have what we call cardiovascular accident, CVA. The blood pressure can rupture, the woman can be bleeding in the brain, you know, all because of intense vasoconstrictions and the chemicals that are released. The woman can go into coma, and they continue, sometimes they have convulsions. And classically, that's what people know as eclampsia. Preeclampsia is when you have hypertension and, when you have hypertension and proteinuria, that's preeclampsia. The fitting and, convulsion is the eclampsia. That's what we call eclamptic convulsion. But by the time it's getting to that, I want to say it's very, very dangerous for the woman and for the baby. You know, it's a dangerous condition, and it can affect up to about 10%, 15% of women. Therefore, that's why when you go to the clinic, the blood pressure must be measured regularly, and the urine must be tested. Not only for sugar because of diabetes, but for protein because of preeclampsia. Because eclampsia is very dangerous. It is commoner in those who are very young mothers, especially those below the age of 18, and those who are old because of some other medical condition, because they could be having chronic hypertension that is now complicated because of pregnancy, or those who carry twins. You know, if you carry twins or multiple pregnancies, yes, that's why I say a lot of stress on the body, and you can have preeclampsia.
Okay.
Cervical incompetence also is pretty common, because what do we mean by cervical incompetence? The other time I was talking about the womb. The upper part of the womb is the body of the womb. The lower part is the cervix. When the cervix is weak, that one can allow the baby to come out before term. And that is what we call, the weakness of the cervix that will make a woman to abort or deliver before the term. And when we say term, it means 38 weeks, which is 2 weeks before the EDD. Therefore, people who have cervical incompetence can either have recurrent abortion, especially after 3 months, what we call the mid-trimester abortion. Abortion in the 4th, 5th, and 6th month, or delivery of a baby prematurely.
So what are the causes of
more often than not, they have had forceful dilatation of the cervix, DNC, especially for termination of pregnancy. When you do termination 3-4 times, every time they do that, they force the cervix to open. When you force the cervix to open, when it closes, doesn't remain as firm as it's supposed to be. And therefore, as the baby is getting bigger, the cervix becomes weak. And you just see the water come out. You see the baby following. Therefore, that's cervical incompetence. It is the procedure to go and close it is what they call cervical sacrilege. And there are different methods by different people. We have the Sheet-Roker method. We have the McDonald's method and things like that. Therefore, the commonest thing is because of traumatic and recurrent dilatation of the cervix. Sometimes some people are born like that. Or if there are uterine anomalies, there are problems, abnormalities in the uterus, yes, you can have that. But the commonest cause in our environment is DNC. Braxton Hicks contraction, technically speaking, is a painless and irregular uterine contraction that comes later in pregnancy, usually from 30 weeks and above. That's the time mothers usually feel it. But I want to say that the uterus is never silent throughout pregnancy. At one time or the other, the uterus will contract. And depending on the intensity of that contraction, you may feel a pain or you may not feel anything. But the Braxton Hicks contraction itself is later in pregnancy. And what it does is prepares the cervix, prepare the woman, for labor. As it's contracting, it's getting the womb to push the baby down gradually. The cervix to start to shorten, and then later to dilate when one goes into labor. Therefore, it's a preparation towards labor. It's usually painless, but sometimes you can feel some mild pain. But by the time it's becoming very painful, regular, and discomforting, you need to get to the hospital so that it is not premature labor. Because there are other things that can be like that, but are not Braxton Hicks. If a woman early in pregnancy, 16, 18, 20 weeks, is having contractions that is painful, that woman needs to see the doctor, because that may be some premature, maybe a forerunner to premature delivery, premature labor. And we need to be careful, because sometimes, and this can be caused by several different things, there could be uterine irritation, especially in our environment. A lot of people have fibroid. Could be due to fibroid. If a woman has fever, fever can stimulate contraction. If you have malaria, it will stimulate contraction. If there's infection, urinary tract infection, can stimulate contraction. That's why we need to be very careful, so that we not confuse all those things with Braxton Hicks contraction. Now, later in pregnancy, it could be a premature labor. It could be a premature labor, which means that the baby may come on before time with all these complications. And therefore, you need to check. But Braxton Hicks contraction is something that comes later in labor, from around, in pregnancy, around 30, 32 weeks, until a woman goes into proper labor. Pregnancy is not a disease, but it's a condition, a physiological condition that can have some complications. And therefore, there are danger signs that we must watch out for. The commonest, or the first, is bleeding during pregnancy. When a woman starts to be pregnant, a woman is pregnant and it starts to bleed, then you need to see the doctor. That one could be due to, it could be a forerunner of abortion, what we call, miscarriage. It could be that there's or some other problems. If it's later in pregnancy, it could be antepartum hemorrhage. It could be that there's going to be labor. So many things. Gamut of things we call bleeding. But bleeding is a wrong sign when you're pregnant. It's something you have to take seriously. Pain. When you start to have pain, abdominal pain, when you're pregnant, you must check out what is causing the pain. I've already mentioned ectopic pregnancy. It could be fibroid. It could be other medical conditions. Nothing says a pregnant woman should not have. It could be premature labor. Nothing says a pregnant woman should not have appendicitis, or you have ovarian problems. You have ovarian cyst of the ovary, torsion of the cyst, hemorrhage in the cyst, and so many things. Therefore, pain, bleeding, abdominal pain, those are two cardinal things that we must get. Sometimes fever. You have fever. Even malaria. Malaria can set up labor. Malaria can destroy mother's blood. Malaria can even affect the baby. Malaria can precipitate labor. And therefore, fever is a big sign also. Fever can make a woman to start to have contraction. And by the time a woman's temperature is about 38 outside, inside it's about 39. Yes, therefore it's like you put a baby in an oven. How would that baby survive? And therefore we need to be careful. Fever is a wrong sign. Draining water could be a very dangerous one, especially when it is not calm. That may be a forerunner to abortion, cervical incompetence, as we said. It could be a forerunner to premature delivery. Therefore, you need to be careful. Water, seeing water. Also, there is we talk about hypertension, talking about preeclampsia, headache. Headache is one of the signs that you should run. You should know. Pain in the epigastrium. Having pain in the upper abdomen. Abdominal pain. It could be to distension of the liver, and that would be maybe a sign of very bad hypertension. Therefore, you need to watch out. It could be that, if your blood pressure is high sometimes, especially when it's going to eclampsia, they could become confused. They can start to see double. or you start to see color, you see rainbow, and things like that. Those are signs of very bad hypertension. Then, when there's a urinary tract infection, the woman not only have fever, it may be having to go and pass urine. With pain when you urinate. Vaginal discharge, especially foul-smelling discharge, could be a foreigner to infection. These are things that we have to watch out for. Therefore, I will say generally, when a pregnant woman sees anything that is not ordinary, that is not normal, you need to check out. You need to check. You must anticipate pregnancy and prepare for it. That we must have pre-pregnancy counseling. Let's be ready. Don't go and bring out babies that you say, okay, I'm not ready, or get pregnant and now looking for a way to go and do abortion. You must be ready. You have to do a counseling. And when you're pregnant, you must get care from the right place with counseling, from those who are trained to counsel. We need to make sure that the mother is healthy. A healthy mother, more often than not, will give us a healthy baby. The mother is the landlord for the baby. And the mother must be okay for the baby to be okay. Many people come to the hospital and say, you want to treat the woman, you want to do this. They say, will it affect the baby? And I tell them, this mother must be okay for your baby to be all right. And therefore, the mother must be healthy. You must take care of you must eat well. You must exercise well. You must have adequate rest. You must maintain good hygiene to prevent infection. Your environment must be clean so that you don't have malaria every time. You don't have diarrhea. Diarrhea can even can cause premature delivery. And therefore, it's a total gamut of things. Yourself, your environment, your people, everything must be conducive to health. That is why those who live in very clean environment, where you have medical facility being developed, good nutrition, woman is given free food when you are pregnant, they give them milk and things like that. We don't have the type of death and the type of complications we have in this part of the world. And therefore, everything must be taken into the socio-economic factor must be there. Even your clinic must not be too far from the house. The medical facility must be developed to take care of pregnant women and to take care of their babies. The people who are working there must be humane. They must have facilities to work with, and they must be ready to help. Therefore, it's not, having a healthy mother, healthy baby, and a healthy society is the responsibility of everybody, the government and the people.